Cincinnati Children's was started in 1883, and in 1931, Colonel William Proctor endowed a $2.5 million endowment that started the Cincinnati Children's Research Foundation. Over the next 130 years, Cincinnati Children's has really blossomed into the phenomenal research facility that it is today. Dr. Malik and her colleagues have developed a sickle cell gene therapy trial, starting from the very basic vector discovery core that we have as a GMP facility. They've developed the vector, they insert the gene back into the vector, and then those genes and those vectors go back into children to cure sickle cell.
Well, sickle cell disease is a red blood cell disorder that occurs due to a point mutation in the beta globin gene. And because of this mutation, every time the red blood cells give up oxygen to the tissues, they don't remain round anymore. They become hook or sickle shaped. These sickle shaped red cells clog blood vessels and interrupt the blood flow to the downstream organs. One form of treatment for these diseases is red blood cell transfusions, and there is not enough blood to go around to treat all the patients with sickle cell disease and thalassemia. One of the therapies is bone marrow transplant, but that's available to only about 10 to 15% of patients. So the majority of the patients really don't have a therapeutic or a curative option available. So we felt if we could fix their own bone marrow, every patient could be their own donor, and we could take a patient's bone marrow, genetically engineer it so that the red blood cells do not sickle, taking bone marrow, fixing it and giving it back to them, and have a lifetime cure and prevent a lifetime of suffering. And that's my motivation of doing all of this.
Viral vectors are used to shuttle genes into cells. They're derived from viruses. However, vectors are different from viruses in that all the viral genes have been removed, and we basically use them as a mere shuttle to get genetic material into the cells. So for sickle cell disease, we produced the viral vector. The development took about 2 years to get to the purity and the efficacy that we needed. We send out samples for testing to make sure that the material is safe to use, and then the material is released for the trial. It's a new type of world. It's up to this point, we haven't been able to really treat the root cause of genetic diseases. And with gene therapy we are. Having a facility like this is advantageous for Cincinnati Children's in that it brings a tremendous wealth of experience to the hospital to be able to help investigators bring their groundbreaking research to a clinical trial, and to do that in-house. That is certainly a benefit to our institution. And for the region, it means that Cincinnati Children's is able to attract researchers from around the world that are interested in this type of research and help drive gene therapy forward. I'm really happy for the opportunity to be part of a team here that can do this type of therapy. To hear about children that are treated here at Cincinnati Children's and all over the world for diseases such as that is it's really a tremendous honor to be able to contribute.